So just a quick summary. I know there's a lot to process here, and it's even for us doing it every day, we think there's a lot of things going on. But I think what's extremely important to remember is all this is on the same platform, a very small budget, and it's all very much linked through what we do on the platform. So our focus, everyone asks what's our focus with everything going on? Our focus has been to make an absolutely world-class platform that can be used in a very wide range of areas very quickly around the world. And that's what we've spent a huge amount of time on. I know a lot of you see myself, perhaps Scott, a lot around the United States. You see our enthusiasm, you see, we think we're really doing great things, but what's really important is to remember behind any project there's a huge number of people. Any successful visionary project that is truly going to change what we do in a lot of ways and change the world, you need a very, very active team to do very different things in a whole lot of different ways. So I think you've seen some of the excitement from our team. There's quite a few other team members here. And I think it's also good for everyone to also see the people we work with on the advisory board and the processes. Very serious people who do very serious work, who are working very, very closely with us to make this a reality. And we can work very, very hard, but without the help of a lot of other people, including our partners. I'll just show you one slide now. This is just the trials we have collected or collecting in the different cancers, never mind a lot of the work we've been talking about today. So this is even more remarkable with a small team and a small budget and the focus we have on getting the platform. But all of these are reasonably easy to run once you have the platform developed. The very large trials being collected around the world and a lot of proof of concept studies, which although they are small numbers are meaningful. The statistical valid, we only use things which are 95% significant. So the smaller trials do tell us a lot about what's going to happen in the bigger trials. There's no point doing trials if they don't tell you, they're just very small numbers. But when you're talking 30, 40, 50 cancers and up to 100 or 200 controls, it does tell you a lot of what's going on. So the vision has always been to get the platform developed, which has gone extremely well, continue to develop it. I think you've seen it's going to be, in our opinion, a whole new area of science and development. So it's not something we can do ourselves in a small number of years, but we've developed along the lines to get these things done. And by doing all of this, going through the small stages and the smaller trials this year, going through starting the larger trials and finishing them off next year, and expanding to a wide range of areas like the Nu.Q Vet, like Nu.Q Capture, and all the fantastic work being done in Asia should provide a huge opportunity for the company and therefore for shareholders. And just an order of magnitude where our market cap is now, successful companies in this space, I won't mention names, but some are worth 80, 100 times what we are, and they're still not just with either a very small percentage of the market in the colorectal space or a small percentage in the DNA space. And we absolutely passionately believe the nucleosome itself is an incredibly important part of what makes us tick, and we absolutely dominate the space in circulation. So if that is true, the epigenetics are as important as the genetics. The next few years are going to be spectacular for us as we roll out the products and all these different things going on, which we will continue to do on a very, very low cost, very focused on the platform.